UVA Medical Center reaches all across the Commonwealth, and today we're going to be with the mobile mammography unit. We happen to be here in our own county, but they reach everywhere from Wise to north of DC. I'm Mary Kay Niehoff, and this is Link on the Road.
My name is Christine Shackman, and I'm a mammographer for the University of Virginia on our mobile mammography coach.
About how many women do you typically do when you do a mobile unit?
17 to 22 ladies.
So you're traveling 4 out of 5 days a week, and I understand you also sometimes go on overnight trips. Can you tell us a little bit about that?
Yes, I can. Our overnight trips are all over the place. One of our places that we go quite often is the far southwest Virginia. It takes us about 9 hours to get there, and we stay overnight 2 nights.
What difference does it make to have a mobile unit versus having people come into the breast care center?
The only difference is that it's a little bit quicker, and it's a little bit more personal, and it's a lot more convenient.
I'm Mary Dreyer, and I'm here to get a mammogram.
And you work at Hollymead Elementary School, is that correct?
That's right. I'm the speech-language pathologist at Hollymead.
What difference does it make to have the mobile mammography unit come here versus having to schedule something at the breast care center, for example?
Well, for one thing, you can be sure that I'll do it because it's so convenient, and I don't have to leave school during the school day and miss a lot of kid time.
The ladies love it because they don't have to take time off from work. We're right at their job site a lot of times. And then the other thing that's also really good is we have the 4 Miler Fund grant that pays for the ladies' mammograms, and it only is if they come on the mobile to have their mammogram. They can't use the 4 Miler grant in the breast care center. With the women's 4 Miler, we're able to impact at least 250 ladies a year. That's how many they give us. The Komen grant is also fantastic. We have 2 sites in the Roanoke area in Craig County that use the Komen grant, and we've been able to screen about 60 to 70 ladies with that grant. We have a lady that actually used the 4 Miler grant last year, and we found a very large breast cancer. I think it was a stage 4 breast cancer that we found using the women's 4 Miler grant. She would not have had a mammogram if she didn't have that grant. So she had it. She got enrolled in, I think, Every Woman's Life program, and then they were able to help her with the cost of the diagnostic mammogram.
This is primarily for screening. It's not a diagnostic unit. So if someone gets a mammogram that looks suspicious, what's the next step?
The next step is they get a call from the girls at Northridge who do our callbacks, and they're either given the opportunity to come to Charlottesville to have their mammogram at the breast care center, or if they live far away, we generally will send their films to them so that they can go to a facility that's closer to them.
Hi, I'm Terry Sheeler, and I'm one of the mobile mammography technologists here on the mobile. This is the tube, and this is where the ladies come in, and we actually do the mammogram.
Tell me what it means to be digital versus the old films that you used to use.
Well, digital, from a technologist standpoint, means that as we take the picture, it instantaneously comes up on our monitor, and we're able to view right then and there if we're meeting the doctor's criteria and their expectations. And the reports do go out a lot sooner. Every time we move the mobile, when we arrive at our site, we arrive 45 minutes before we start seeing patients. We perform tests, their QA, quality assurance test, that make sure that it's properly calibrated.
I'm John Wright, and I am a driver for the mobile mammography. I've seen several sites, and we've interviewed a lot of patients as far as patient history, and I've seen the interactions between the technologist and the patients, which are fabulous. The patients really appear to be comfortable, and you get to see a lot of nice scenery and a lot of nice people.
Today we got to see the mobile mammography unit. I'm Mary Kay Niehoff, and this has been Link on the Road.